male, complains of fever, headache, vomiting, and altered sensorium of 1 week duration.
So what do you think about this case?
Um, my first possible diagnosis meningitis, sir.
Okay, that's right. Any other differential diagnosis?
Fever. CVT, sir. Cerebral venous
That's right.
thrombosis.
That's right. Yes. Anything else? Encephalitis,
This. Encephalitis, sir.
brain abscess,
Yes, sir. Brain abscess.
cerebral malaria.
Yes, sir. Cerebral malaria.
Okay. What? So you already said you have differential diagnosis.
Yes,
Okay,
sir.
fine.
Past history of light chain amyloidosis, cutaneous and cardiac for 4 years. March 23. Multiple myeloma on chemotherapy. Status was allogenic stem cell transplant done on polydomide and tap folvite.
On examination.
On examination, pallor present, nodules present in the neck and axilla, and on the eyelids. CNS signs of meningeal irritation present.
So at this point of time, your differential diagnosis remains same or changed?
My first DD is meningitis itself, sir, and encephalitis.
Okay.
Why not? Okay, sir.
So what is the investigation you plan in this patient?
Lumbar puncture, sir.
Yes.
High pressure, opening pressure of 380 with lymphocyte 33, protein 591, and glucose of less than 20. So it's a high opening pressure, lymphocytic pleocytosis, low glucose, and high protein.
So what is your differential diagnosis?
Fungal meningitis,
What
viral
your
meningitis.
viral meningitis possible? Yes. What about the sugar?
Sugars are less bacterial. TB meningitis.
Meningitis could be just this low and only 1 week duration.
Eh, yes, sir. No, no, no.
What do you expect in viral glucose level?
Will be normal, sir.
That's right. So it is significantly low.
Yes,
So
sir.
what is it?
Significantly low, sir.
So what else you want to do with the CSF?
Fluoride levels.
Yes. Anything else?
Culture and sensitivity, sir.
Anything else?
Staining, gram staining,
Grams? Anything
fungal
else?
staining. Sir,
Okay.
CB net.
So he underwent blood counts, and this is the picture.
Yes, sir. Total count was 1.41. Uh, and the ESR was on the higher side, 110.
So,
Rest of the was normal, sir.
so what do you think it is all about? Leukopenia.
Yes, sir.
It is
Leukopenia is there.
DSR, raised DSR. Yes.
URE shows
Normal. Okay. What is this showing?
uh, CSF shows listeria, sir.
Biofire. Biofire shows listeria.
Listeria meningitis.
Okay. So, what does this show?
Susceptible to ampicillin, gentamicin, penicillin, and vancomycin.
So,
Meningoencephalitis, Listeria monocytogenes, sepsis of Listeria, multiple myeloma and chemotherapy, light chain amyloidosis, skin and cardiac involvement, status post autologous stem cell transplantations.
so gram stain, what do you expect to find?
Gram positive
Sorry,
rods, sir.
rod should be seen. Okay.
Yes, sir.
So, uh, meningitis is one presentation of listeria.
Yes,
So,
sir.
bacterial, fungal, viral, tuberculosis. Here we thought of
Tuberculosis.
bacterial. because of low sugar. So
Yes,
biofile,
sir.
CSF culture,
Yes, sir.
blood culture. Blood culture also give the same.
Yes, sir.
So final diagnosis.
Okay, sir. Listeriosis, systemic listeriosis.
So what is listeria?
Uh,
Gram positive,
Listeria is a gram-positive bacteria, sir.
bacillus.
Gram-positive bacteria, sir.
What are the types of listeria infection?
Mm. Focal, skin, eyes, hepatitis, cholecystitis, and gastroenteritis, sir.
And it can be
Focal and invasive, sir.
invasive type. What do you think is this case?
This case is invasive type, sir.
Invasive, yes. So what are the predisposing factors for listeria?
Steroids, solid tumors, transplant patients, AIDS, drugs including TNF alpha blockers, CKD, diabetes, iron overload, cardiovascular disease, liver disease, alcohol, and pregnancy.
Yes. And how does what are the CNS manifestations of listeria?
Uh, Cranial palsies, ataxia, tremor, hemiplegia, and deafness, encephalitis, specifically may target brainstem cell.
So how will you recognize rhabdoencephalitis, brainstem encephalitis? It will produce cranial
Brains.
pulses.
Yes, sir. Yes,
So
sir.
what are the CSO findings in listeria?
Um, Either polymorphs up to 100% or lymphocytes up to 100 percentage, elevated protein, decreased glucose, uh, blood culture, and CSF biofire and culture may reveal, and also MRI for rhabdoencephalitis.
In our patient, blood culture was positive, gram-SIN was positive, biofire was positive, and CSF culture was also positive. So how do you treat this patient?
Yes, sir.
How do you treat this patient?
Sir, since it's an invasive, high dose ampicillin should be given, sir.
Yes. So ampicillin was given
2
12
gram
grams, 12
uh,
grams per day.
every
That's
fourth hourly.
yeah, that's right. So
Yes, sir.
how do you treat other types of listeria? If it is listeria gastroenteritis, how do you treat?
Depends upon the duration, sir.
Okay. Listeria, how long?
For means depend upon the disease, sir.
Yeah.
Gastroenteritis 2 weeks, invasive disease 3 to 6 weeks, endocarditis 6 weeks, sir. And invasive disease we will add gentamicin for 2 weeks only, sir. And no steroids to be given, sir.
Okay. What is the predisposing factor in our patient?
Solid steroids transplant was there, sir. When patient may be on steroids,
And he had leukopenia also, no?
multiple
Also.
myeloma. Yes, sir. Leukopenia, sir.
So it's a listeria meningitis in a immunocompromised patient.
Yes, sir.
Thank you, Vishnu.
Okay, sir. Thank you, sir. Thank you, sir.
How many cases you have seen?
Listeria, sir. I